I don't know if you were aware or not, but your late night habits could be silently sabotaging your brain and increasing your risk of developing dementia. If you routinely skimp on sleep, your risk of dementia could be around 50%. It sounds like an exaggeration, but one sleepless night can cause a spike in the very same toxic proteins that form Alzheimer's plaque in the brain. So if your sleep schedule is erratic, or if you have insomnia, research suggests your risk of developing dementia shoots up by as much as 53% compared to people with good sleep. These findings are shocking, and they highlight a vital truth. Sleep is not just downtime. Sleep is a critical guardian of your brain. I've spent decades studying the brain, and I'm deeply concerned about how casually we treat sleep. Every week I hear patients asking, why is my memory getting worse? I've come to learn that often a major clue is their poor sleep. I have to tell you, the science we're discovering about sleep and Alzheimer's disease is as fascinating as it is alarming. You might wonder, is it proven that lack of sleep causes Alzheimer's, or could it be the other way around? The answer is actually a bit of both. In a sense, it's true. Alzheimer's patients often have terrible sleep. Many experience insomnia or sundowning confusion at night. But more importantly, sleep problems often start before any memory loss shows up. It could be one of the earliest warning signs and possibly an active contributor to the disease process itself. Think of poor sleep and Alzheimer's as a vicious cycle. Poor sleep may accelerate Alzheimer's changes, and those changes in turn wreck sleep further. That's all the more reason to intervene now by prioritizing better sleep to break the cycle before it spins out of control. I'm speaking as someone who's seen firsthand what happens when sleep is neglected. If you're someone who says, I'll sleep when I'm dead, this message is especially for you. Spoiler, lack of sleep might make that day come much sooner. My goal in this video is to wake you up, ironically, to the importance of sleep for your brain and to empower you with knowledge that could literally save your memories in the long run. Let's talk about why sleep is so crucial for your brain in plain English. When you sleep, especially in deep sleep, your brain switches on a nightly cleaning service. Think of it like a dishwasher for your mind. Cerebrospinal fluid, the clear liquid surrounding your brain, actually washes through brain tissue, scrubbing away waste products that build up during the day. Among these waste products are things like amyloid beta, a sticky protein that clumps up into plaques we see in Alzheimer's disease. In fact, one study showed that during deep sleep, the brain's cleaning system, also known as the glymphatic system, is almost 10 times more active than when you're awake, removing significantly more amyloid waste. Imagine that. Your brain literally takes out the trash when you sleep. To picture it another way, a neuroscientist described the brain like a house party. You can either entertain the guests or clean up the house, but you can't really do both at the same time. When we're awake, our brain is busy entertaining, learning, working, experiencing life. It can't fully clean up those toxic byproducts at the same time. Only when you fall asleep does the brain kick everyone out, so to speak, and mop the floors of your mind. If you cut out your sleep short or have fragmented, poor quality sleep, that cleaning crew doesn't finish its job. Night after night of this can leave behind a trail of brain trash, including amyloid plaque and other proteins that gunk up the works and interfere with the normal functioning of your neurons. Now, besides cleaning, sleep does other miracles for your brain. It helps consolidate memories. Basically, it moves what you learn during the daytime into long-term storage. That's why a bad night's sleep makes you feel foggy and forgetful the next day. But more importantly, chronic poor sleep can set the stage for long-term memory problems. How? By allowing those toxic proteins to accumulate and by failing to give brain cells time to repair. Over years and decades, this can contribute to the brain changes of Alzheimer's disease. By now, you might be thinking, all right, bad sleep is bad, but I do get some sleep. Is it really that serious? So here's a reality check that surprised even me when I dug into the research. It's not just about how much you sleep, but when and how you sleep. Consistency and quality are key. A 2023 study in the journal Neurology found that people with highly irregular sleep times, meaning they went to bed and woke up at inconsistent hours, were 53% more likely to develop dementia than those with regular schedules. That's a huge increase in risk for something so common in our modern 24/7 lifestyle. If you're a shift worker or someone who sleeps in on weekends and burns the midnight oil on weekdays, this finding should be a red flag. And get this, it's not only chronic insomnia or weird schedules that matter. Even the total amount of sleep can be a Goldilocks situation. Both too little and too much sleep have been linked to cognitive problems. In fact, one large review study found that routinely sleeping less than 7 hours per night was associated with about a 63% higher risk of developing dementia, and sleeping more than 9 hours was linked to an even higher risk, over 100% higher. Yes, you heard that right. Consistently oversleeping might also signal unhealthy sleep or other issues. The sweet sweet spot for most adults seems to be around 7 to 8 hours of quality sleep per night. So you can't just say, I only get 5 hours on weekdays, but I crash for 12 on Sundays. Your brain craves regularity and balance. One more surprising stat. A study from Harvard noted that people who slept fewer than 5 hours per night had about double the risk of dementia as those getting a healthy amount of sleep. Double? Imagine that. Imagine a pill that could cut your dementia risk in half. We would be all over it. Well, maintaining good sleep might be that pill. It's that powerful. We often talk about family history and genetics, which you can't control. But here, we're talking about a risk factor that you can control. And that's huge. From a lifestyle perspective, this is actually good news. For example, if you have sleep apnea, which is pauses in breathing during sleep, and by the way, about 50% of Alzheimer's patients have sleep apnea, getting it treated with a CPAP machine or other therapies might not just help you feel more rested, it could also reduce that chronic nightly stress on your brain. If you have insomnia, working with a professional on cognitive behavioral therapy for insomnia, CBTI, or other solutions could potentially be an investment in your future cognitive health, not just your mood. For an easy 5-step 72-hour sleep reset, you should watch my video on fixing your sleep in 72 hours linked on the description below. Now, let me share a quick real-life scenario. This is a composite of many patients I've seen. Picture a 55-year-old professional burning the candle at both ends. Late nights, early mornings, proudly proclaiming she only needs 5 hours of sleep. She's successful and healthy, so she thinks everything is just fine. Fast forward 10 or 15 years later, she's in her late 60s and starting to experience memory lapses. By her 70s, she's diagnosed with early Alzheimer's. Now, Alzheimer's has many causes, and we can't say lack of sleep is the sole culprit. But when I go through her history, it stands out like a sore thumb. Decades of chronic sleep deprivation. Could things have been different if she took sleep more seriously? There's a decent chance the answer to this question is yes. We'll never know for sure in an individual case, but population studies strongly suggest that many causes of dementia could potentially be delayed by better sleep habits. It's heartbreaking to think that something as simple as sleep, which we often sacrifice for work, for family, to socialize, or because of untreated sleep disorders, might be a key to keeping our minds sharp. The real-life consequence of ignoring our sleep is that we might be unknowingly increasing the odds of facing one of the most devastating diseases known to medicine. Conversely, the real-life benefit of prioritizing sleep is not just feeling energetic, it could be preserving your memories and personality decades down the line. I find that incredibly motivating. By now, I hope it's clear that sleep is a serious matter for brain health. So, what steps can you take tonight to start protecting your brain? The good news is there are practical, proven strategies to improve your sleep. In fact, the CDC and NIH have put out recommendations for healthy sleep habits. Here are a few of the most important ones. Number 1, keep a consistent schedule. Go to bed and wake up at the same time every day, even on weekends. This keeps your internal clock and circadian rhythm in sync. Number 2, have a wind down routine. Use the last 60 to 90 minutes before bedtime as quiet time. Dim the lights, turn off screens, maybe read a book or take a warm shower or bath. Avoid heavy meals, caffeine, or nicotine in the evening as these can disrupt your sleep. Number 3, optimize your sleep environment. Make sure your bedroom is dark, cool, and quiet, and that your bed is comfortable. Consider using earplugs, eye masks, or white noise if needed. Your brain should associate your bedroom with relaxation and sleep. Number 4, stay active during the day. Regular daytime exercise, even a daily walk, can help you sleep better at night. Just try not to do vigorous workouts right before bed, as that can be too stimulating for some people. Number 5, avoid frequent all-nighters or shift rotations if possible. Sometimes our jobs or life circumstances demand tough hours, but try to minimize abrupt changes to your sleep schedule. Consistency is key, as we discussed with the 53% statistic earlier. These might sound like small things, but they add up. Think of good sleep habits as an investment plan for your brain's future. Every night of quality sleep is like a deposit in your cognitive health bank account, and it can pay dividends later. And if you're struggling with a serious sleep problem like chronic insomnia or sleep apnea, talk to a healthcare professional. There are effective treatments and therapies for these. For example, CBTI for insomnia is highly recommended over long-term sleeping pill use. Don't be shy about seeking help. Think of it as preventive medicine for your brain. I hope by now you're convinced that sleep is not just a luxury, it's a necessity for your brain health. The relationship between sleep disturbances and Alzheimer's dementia is an eye-opener. It's science that many people still don't know, but you know it now, and you can act on it. If this video surprised or inspired you, I invite you to join our community. Subscribe to the channel for more eye-opening insights on brain health and lifestyle. We cover everything from nutrition to stress management to cognitive exercises, all grounded in science. Give this video a thumbs up if you found it helpful. It really supports our mission to spread this crucial information. And I'd love to hear from you. How many hours of sleep do you usually actually get. Did you realize how important sleep is for your brain? Are you planning to make changes after learning this? Share your thoughts or questions in the comments below. Remember, taking care of your brain is a marathon, not a sprint, and sleep is one of the pillars holding up that marathon. So tonight, do your future self a favor, turn off the TV a little earlier, dim the lights, and allow yourself to get a good night's sleep. Your brain will thank you, not just tomorrow when you feel alert, but decades from now. Until next time, I'm Dr. Cardiel, and I'm here to remind you, take sleep seriously. Your brain depends on it. Sweet dreams, and stay healthy.